Welcome, everybody. This is the Rotary eClub of Silicon Valley. We are excited to bring you another program by one of our own. We have with us Dr. John Phillip, who is a longtime Rotarian. He is a member of the International Fellowship of Healthcare Professionals, Rotary Healthcare Professionals. He is in England. He is a wonderfully interesting guy. I know, I've talked to him, and we are excited to have him be part of what we are doing today. And with that, John, I will hand it over to you for your presentation.
Well, thank you, Christian, and thank you. Hi, guys. I hope you're all safe wherever you are. May I, first of all, bring you greetings from the United Kingdom. I'm here not too far from London. Cold, miserable, wet day. Then what do you expect in the summer in the UK? Look, I just want to ask you a question. If have you ever come across an advert like join, say, us and change the world? Or volunteer with us to transform communities, etc. You may well have seen. If not, have a look on the website. There are many adverts like that. And Rotary is partially guilty of this. Some of the Rotary adverts also say, join us, you can change the world. But I'm going to turn this on its head and say, I think first of all, we need to change ourselves before we can change the world. And a Rotary has changed my life, and I'm going to share with you a seminal moment with when Rotary had a transformational effect on my life. Now, in 2008, I was district governor. My wife and Krista here traveled to Tanzania. I don't know how good your geography is, but that's the African continent on the left of your screen, and the Tanzania, a picture of Tanzania on the right side. Well, the reason why we went out to Tanzania was to meet some Rotarians, none of whom we had met before. And the purpose of our visit was to explore the possibility of a collaborative project with Rotary in Tanzania to reduce maternal and child mortality. Well, you guys look too young to remember that reducing maternal and child mortality was one of the Millennium Development Goals. And Rotary International decided to take up that challenge and galvanize Rotarians at grassroots into action. Look, I think Rotary, sometimes I think we got to look at ourselves. Rotary comes up with these wonderful ideas, but they never tell you how to do it. There was no plan, there was no purpose, there was nothing. Simply, let's make dreams real. Let's go and reduce child mortality. By the way, I'm a surgeon, and this is a topic that really appealed to me. But what do I do here in the UK? Child mortality is quite low, maternal mortality is quite low. But if you remember your statistics, you will know that the vast majority of maternal and child mortality are in sub-Saharan African countries. One of the highest maternal and child mortality is in Tanzania. Now, those of you who can recollect your school days will know that Tanzania is the 13th largest country in Africa, 45 million citizens. And do you know what the average income of the people in Tanzania are? $1.25 per day. And 32% of the population in Tanzania are malnourished. Now, from Dar es Salaam, you can see the little red blob on your right side. We flew to a small town by Lake Victoria called Mwanza on your right side. Now there, we had established contact with some local Rotarians who were very kind enough, and they took us to 4 different hospitals on the mainland. And each one we could have actually partnered with. But on the last day, they took us to a hospital on an island in Lake Victoria. You can see Lake Victoria there, and there's an island which is accessible by a 3.5-hour ferry journey from the mainland. That island is called Ukerewe, U-K-E-R-E-W-E, and I invite you to come with me to Ukerewe and meet some of my amazing friends in Ukerewe. I've made some real amazing friends in Ukerewe. Now, the government hospital in Ukerewe with 120 beds served a population of 350,000 people, many living in remote villages and some on satellite islands. Now, get ready for a shock. The medics show me around, and they knew I was a surgeon, and they showed me around. I said, "Look, take me to your operating theater. I'm interested in seeing that." And they had just finished an important operation in this operating theater on that operating table. And this was the theater light that was hanging from the roof. And this was what we call the sterilizing room. I think Sandy will probably remember these things from her training days. This is where they washed their hands, and the sterilizing equipment on the left side was a kerosene stove. They took us around the ward. We had a look around, and this was a medical ward. And it was not uncommon to find mothers and children sharing a bed. And look at the wonderful mattress that you can see there. Now, I think there were mosquito nets, but of course we could use that. Now, just as we were coming out of the hospital and leaving, by the way, that lady in her red top is my wife, and the lady in the nurse's uniform was the matron. Now, she held my hand and said, "Doctor, you will come back, won't you?" Now, the reason why she asked me that question was many clever NGOs go to this island, take photographs, and they disappear. Wonderful opportunity. I think, some of us are sometimes guilty of things like that. On the way back on the ferry, Chris and I looked at each other and thought, well, look, we have seen 5 hospitals. The other 4 is easy to access, and there was already some developmental projects going on there. We could actually go there and put a tick in the box and do something with the people there, the medics there. No, we decided that this is where we were going to work. Now, we had no money, we had no plan, nothing. But my goodness, Rotary is an organization which can actually attract clever people. All that you need to do is to go and talk to people. We came back to Yorkshire, that's where we lived in the United Kingdom, put out an appeal, gathered enough hospital equipment to be able to send out a 40-foot container right across the ocean into Kenya and across the road, on the road to the island of Ukerewe. An amazing, logistically complex operation managed by Rotarian friends. Now, I think in the first, there's no point in sending a container. I need to take some guys out there. I put out an appeal. Look, would you like to come with us to this forgotten island in Tanzania, in Lake Victoria? And there were 23 Rotarians volunteering to go at their own expense. They had no clue where they were going, and they had no idea what they would face. Travel was difficult. That is the ferry. We shared our accommodation with cows and goats and bananas and local people and so on and so forth. We got there and we transformed that particular hospital, that particular thing you saw earlier on operating theater, you saw into this. But wasn't that an amazing transformation, what Rotary could achieve in a very short time? Now, in the last 12 years, we have traveled to the island over 15 times, taken a number of volunteers out there, and we have helped to refurbish a dilapidated building on the left side. The medics asked us, could you just take this building and transform it into a waiting hostel for pregnant women? Oh, no problem at all. We came back, we took some builders with us, including a concrete mixer, and we transformed that into a 20-bed waiting hostel so that pregnant women can, in the latter stages of the pregnancy, can come, stay there, and then move into the hospital when the time was right. Since then, we have got involved with schools, equipped a school library, supplied with water filters. This is the standard water filter researched by a Canadian firm, sand filters, which will filter dirty water, and most of the stuff that comes out in the end is drinkable. Now, we have undertaken a large number of projects on the island, put water harvesting system, and also at the time we came across a group of people who some of you may know are called albinos. They are the people who have no pigment under the skin, and they are exposed to the ultraviolet rays in the sun and develop serious cancer. But if that was the only medical problem, that could have been manageable. But there is also a problem that there is a myth amongst the witch doctors in Tanzania that body parts could fetch them a lot of money because it is believed to have magical powers. But we were able to set up village meetings on a separate grant from Rotary. 3 years of hard work by Rotarians changed the people's attitude, and the latest statistics from Tanzania show that the attack on the albino community is much lower than it was. We have set up agricultural projects in schools. We have converted derelict land into farms. We have encouraged kids to have something to eat when they come to school in the morning. And we have refurbished some of the classroom buildings. So these are some of the desks that we have just created, made by the help of vocational school pupils on the island. It has been possible to do this because in Rotary, there is a huge desire to help and to overcome challenges. And taking on projects like this is never easy. The accommodation there on the island is poor, but my goodness, I think we have had wholesome, freshly cooked meal on that in that little pot. You can see chicken boiling up there for our dinner one time. That's the high street in the town. We go around fetching material from hardware shops locally, and we actually mix with people. When we go out there, we live with them, we walk with them, we eat what they like, we generate trust. They are our friends. They are our extended family. And there have been numerous challenges in undertaking these projects. Some of the things we supported have failed. We have faced incompetence, lack of motivation, perhaps corruption. We have met some skeptics, have faced questions. Why should we support Africa? They breed like rabbits. They are all corrupt. We need to invest our money and efforts in our own local community. But this is so true. We do need to address some of the problems, challenges that we face in the first world. But are we going to wait until we get rid of all such challenges in our communities? Some can only be described as unique to first world problems before we save a mother, provide some decent education for those kids you can see on your screen. But I do believe that that Rotary has no borders, no color, or no creed. Those guys you see on your screen are our brothers and sisters, our children, our grandchildren. And when one part of Rotary, this family hurts, we hurt. And Rotary connects the world. It breaks down barriers. Thanks to Rotary, I have learned to discover who I am, appreciate and value what I am and what I have. It has made me more aware of those by no fault of theirs struggle to make both ends meet. And this is what we get in return, friendship and trust. Thank you guys for listening to me.
What a powerful presentation. John, thank you so much. We surely have plenty of questions, and so I'll ask our team to let me know in the chat when you are ready with a question. A little bit about the information about our club for those who are viewing this recording, this presentation. We are part of Rotary International, 1.2 million members in 36,000 clubs around the world, people who want to make their local and global community better in some fashion. And we are excited to be able to share stories of those who are acting on that desire to make a difference. I'll start the questioning for John. And John, when we look at a project like this, you talked about how your first group looked at 5 different hospitals. 4 of them were in relatively good shape. There was this one that had these obvious needs. How do you address those problems and not risk, and maybe the answer is you can't, but and not risk having local government authorities there say, we don't need to help this hospital because these other people are doing this. We can push funds in another direction. Or is there a mechanism for allowing partnership with government agencies such that they get buy-in to the process in some fashion?
Well, see, that's where Rotary has got enormous network. You, first of all, you travel out there. You got to physically go and see the challenges. You sit with the guys there. You go and meet the authorities, the district council, the community leaders, the ordinary people in the street. You talk to people. And then you come back, you sit with some of the key people in the community to say, look, you don't have water supply, you don't have sanitation, your schools are a lot of, I mean, you don't put it in so many words. You listen to their challenges. And then you come across, you come to a consensus that we can't change everything, but maybe we can just take your operating theater and refurbish it. What do you think about that? Until they buy into that, you don't do anything. So the problems, the solutions to problems in communities lie within the community. So listen, plan with their consent and with their agreement. The other hospitals would love to have us, but we had to tell them, look, I think Rotary has this, certainly I think from my experience, has this bad habit of taking on things which nobody else wants to do. Look at polio. You know, so let us take on things which let us leave all the easy things to other NGOs. Let us go and do things which nobody else wants to do.
Wonderful. Nate, in Japan, you have a question.
Yeah, first, thanks a lot for that presentation, John. It's, yeah, like Rushton said, quite powerful. You had said something early on that kind of resonated with me. And it's you know, the nurse who had said to you, you know, will you come back? You know, because people do their service tourism. You know, I felt like a disaster tourist, you know, after the Tohoku earthquake in Japan. And I feel that some people might hesitate to get involved in projects because they feel they don't have the capacity to commit in the long term. I know myself, there are some projects I'd like to get involved with in Japan that I just fear that I won't be able to commit. I don't want it to be a one-off. So I don't know if I have a question, but maybe if you could kind of talk to that, like how can people, you know, what can we do to get people to find that project that they can, you know, truly help with and commit to it, kind of thing. I don't know if that's articulated well, but.
Well, Nathan, thank you for that. You raised an important point. I think there are people like me who can go out and investigate and come up with ideas. There are people like you who say, well, I can't do it at this time, but let us actually come together. That is the power of Rotary. There are some guys who are good at doing something. There are some guys who are doing it other things. We could not have done this but for the help and support of Rotarians and other people. Then you have a story. You have people, you have stories to develop. You tell your story to other people and you motivate people. And that's what we are very good at. We have credibility, we are non-political, we are non-religious, and we have enormous credibility. Rotary brand is powerful. And I went out and I went and spoke to my medical colleagues, my church, my schools, and you know, people just felt touched and moved. And who will not actually weep when you see some of those pictures that I showed you, and a lot more, suffering, you know, a child dying because a child had, we took my wife carried a child in her hand, saw it wriggling and dying, because all that the child needed at that time was a little some injection of paracetamol or something like that to reduce the body temperature. And whose heart will not melt when you tell that story? So Rotary, I think, if you carefully plan something, investigate, come up with projects, sell it, raise funds, implement it, produce provide report, and that cohesive approach is what actually makes projects like this successful. Second point that you raised, please never get involved in short-term development projects. You cannot solve complex problems in the community by going out there or supporting somebody who wants to dig a well or build a classroom and go and have a photo opportunity and come back and say, haven't I done well? Please don't do that. Poverty is at the heart of these sort of problems, and education, trust, long-term. We went out there like all other people to do for 6 months. 12 years later, we are still there. Last night, I had a meeting with my guys there saying that, we need to do something more. So my suggestion is that take on a project, a community-based, wholesome, joined-up project, work with that community and transform their lives as much as you can. You can only take one step at a time. If you transform those kids, they will become motivated and they will solve their own problems. I'm sorry, it was a long answer.
No, that's a great answer. No, thank you.
Wonderful. Sviatko, you have a question. Sviatko is in Johannesburg, South Africa.
Yeah, thanks, Rushton. Thank you, John, so much for this presentation. It's really cool to see your passion and dedication for this project and the people there. My question is more, so you spoke about how initially you went there to kind of help with the hospital, but it seems like it transitioned to kind of a more holistic development approach where you worked on the education aspect of it and other things. Can you speak a little bit about that process? How did you decide what do you do first? What do you do next to ensure especially to ensure the sustainability of the work that you're doing and the more holistic impact that you're having on the community beyond just the healthcare improvement?
Yeah, I did mention that I did make mistakes, and I'm the first one to hold my hand up and say that in my district governor year, what did I want? I wanted glory. I wanted glory. I went out there to have photo opportunity to transform the theater into a better, usable one, safer one. But when I was there, that transformed me. And on the way back on the ferry, there were 23 of us. We have this very bad habit. If you guys come with us, at the end of the project, what will happen is that we will give you a notebook and a pencil and ask you to sit quietly, go into a corner and write something down. And there was one sentence one fellow wrote down to say that, John, what we did was wonderful, but I think what I gained is even better. So once you're there and interacted with and seen the power of Rotary, and the satisfaction and the change that is going to bring about in that society, you change yourself. We went back after 6 months after we did the first project. Just my wife and I, we flew out at our own expense there. We wanted to see how we had done, and they were actually. We hadn't expected such a marvelous reception for us. They held our hand, they took us around, and they said, "Please come back again." So the request comes from them. Then they take us to another area. We could do with a rainwater harvesting system in the school. We could do with some water pipe here laying in the school. And the schools, then you sit down with the head teachers and say, look, our kids walk to school miles sometimes having nothing to eat. Can you help us to develop our land into a farm? You go and talk to the farmers then. So we spend about 2 or 3 weeks before each intervention, listening to them, developing a project. And it is addictive. I think international development work is addictive. You can't let go. 12 years on, we are still there and we are still planning our next phase. And there are guys like you, we enroll. And so don't go away. You are part of my team now. And we would like you to take on something, and I can expose you to other communities who are as much in need as the community in Ukraine.
Wonderful. Here in the Bay Area, Sandy, part of our healthcare professional contingent in the eClub of Silicon Valley, you have a question.
Thank you for your presentation. It's been amazing, and it makes me so much, I miss going on trips. So I'm a nurse, and I've been on many cleft lip and cleft palate trips. And what you were saying about it being addictive, it's 100% addictive. You go on one trip and then it's like, okay, when can I go on my next one? Even though you come back and you're exhausted, but your heart is so full. But my question is, were you allowed to do, or did you do any surgeries at the hospital? And was there like any education, for the staff? Like, could you teach them anything? Because I know that's always part of what we do, is because most of the staff, they've never repaired a cleft lip or cleft palate. So
Sandy, there are two things about actually going out as a doctor. Yes, you are quite right in saying that they sometimes come and ask you to help or assistant. I think I have a couple of pictures of me operating, but I would suggest to people that we are no good at doing things there the way they do. They can work without light. I mean, there was an emergency surgery done with head torch by a surgeon. He did such a good job. They don't bother much about safety or washing hands or things like that. I worked in Nigeria. My daughter, who is a doctor, was in Ethiopia. We went out to see them, and I've been into Ghana. By and large, I've learned that I have this enormous temptation as a surgeon to roll my sleeves up and do heroic things. But I have learned to step back and say, no, that is not what you're here for. Yes, you can train them, but train them the way they want to do things, not what you think they should be doing. And when I went with a consultant obstetrician, and the first thing he told me when we got onto the plane, having bought me a gin and tonic, he said, John, I will tell you something. I will kill you if you tell anyone in Ukerewe that I'm a doctor. I want to erect shelves in this is one of our library construction. I'm good at woodwork. That's what I want to do. Sometimes I think just by being there, working with them the way they want to do, they just want friendship. And they are damn good at doing things that they are doing. Even when I took my builders out with me, the first thing that we did was go and see their own building team and ask them, how would you plaster this wall? How would you make this brick wall? And we always try to learn from them. So I think the answer to your question is that I'm not interested in sort of filling gaps, going there, doing heroic surgery, taking pictures and coming back, but training and giving them motivation and aspiration, telling them that they're doing a good job, but you may be able to do it a little bit better if you did it this way. That's all that we do.
A last question, which is about the fellowship. So many people who are in Rotary have only a kind of a tenuous understanding, really, of what the fellowships are about. Can you tell a little bit more about the Fellowship of Healthcare Professionals and your involvement in it?
Russian, you have come to the right person. I am so passionate about this because there is Sandy sitting there, and I don't know what Nathan's background is, but there are hundreds of healthcare professionals in different parts of the world, all sitting on their pretty side, wondering what to do. I didn't say anything expletive. Sitting, what can I do? What can there are medics here who say who are probably one doctor in a club. What can I do? Coming together, A, you immediately learn from other people. B, you come up with projects working together. I work with a team of doctors in India and Delhi. We are currently trying to get involved with COVID thingamies in India, and we have an amazing network of healthcare professionals. The first thing is breaking down barriers. There are some countries where doctor is God, and there are some countries like the UK where we work together, multidisciplinary, sharing, supporting each other. During the pandemic, we have been able to offer support for people who are working at on the sort of front line. But we have some amazing projects. If you give me 1 minute, I'll tell you, we are currently, we have a group which is chaired by one of your directors from the US, from Texas, who is putting together an international team to work with WHO on producing guidelines for patient safety in developing hospitals, Sandy has traveled, so will tell you, sometimes they don't actually mark the side of an operation when a patient is wheeled in the operating theater. You know, if you look on your own in your system, there are hundreds of wrong operations done. Do you realize that more patients come to harm in hospital than anywhere else? More patients die because of damage and because of mistakes done within hospital. And we have developed different systems in hospitals. So we have a group now working for patient safety. So we have another group. You know, you probably would have supported the donation of medical equipment to other hospitals or to other clinical facilities. But how often do you actually look at the sustainability of that, training of that? Have they got the right kind of kit? Have they got the right kind of spare parts? Can they make use of what they are using? You know, I have seen digital X-ray machines in hospitals which they could not even actually diagnose or read or to understand anything. Rotary throws money, not Rotary, many NGOs throw money at projects that actually do not maximize the output. So we have another group working on that. We are going to work on a group with reducing road traffic accidents. How can we do that? Child health. We want groups of people coming together, and I sort of find out where the skill is and actually try to work out projects which we can actually undertake at grassroots level. So Sandy, join us, and all of you who have got any doctor or any healthcare professional in your club, persuade them, point them in my direction. Life will never be the same for them once they come to know of me.
Excellent, John. Your words remind me of the words of Mick Ebeling, a gentleman who decided to help people learn to 3D print prosthetic limbs in remote parts of the world. And he said, I have a philosophy. First you commit, then you figure out how the heck you're going to do it, which sounds like the Rotary commitment that you described during your presentation. We will continue the conversation after we finish the recording in the next few moments. And those of you who are watching the recording, you missed because we kept talking. So we hope that you will join us in some of the live recordings soon. It is one of the perks of being part of our club and knowing that you'll get the chance to interact with fascinating people who are doing work that makes a real and lasting difference in the lives of others. We ask that you, if you are a visitor, you do two things for us. First, you let us know you were here. There is an attendance feature a little bit farther down the page. Successfully typing in your email address, you'll get an email you can pass along to your club secretary to make up a miss. And then farther down is our discuss forum section, where you can talk about things that you learned as a part of this presentation, respond to others, and give us your thoughts on other elements of the meeting as well. As we always like to do, we hand it back to our speaker for a final word. And so, John, what I'll do is I'll pass the mic back to you to finish us off.
Right. Thank you ever so much for Rushton, particularly for giving me this opportunity. But if you liked what you heard, tell others. If you didn't like, blame Rushton.
Ladies and gentlemen, thank you for joining us. We will see you next week.